Hi, everyone. I'm Mark Ames. Welcome to Five on the Frontline, produced by AIHA. Our guest today is Dr. David Michaels. Dr. Michaels is an epidemiologist and professor of environmental and occupational health at the Milken Institute School of Public Health at George Washington University. He served as Assistant Secretary of Labor for Occupational Safety and Health at the U.S. Department of Labor from 2009 to 2017. He's the longest serving administrator in OSHA's history. During the Clinton administration, Dr. Michaels served as an Assistant Secretary of Energy for Environment, Safety, and Health, charged with protecting the workers, communities, and environment around the nation's nuclear weapons facilities. Much of his research focuses on protecting the integrity of the science underpinning public health, safety, and environmental protections. Dr. Michaels is a member of the Biden-Harris COVID Transition Advisory Board. Welcome to the show, Dr. Michaels.
Oh, thanks very much for having me on your show, Mark.
Dr. Michaels, you've voiced strong support for an emergency temporary standard on occupational exposure to COVID-19. Help us understand what this would do and why you support it.
Certainly, Mark. First, I think it's very important to acknowledge this is a massive worker safety crisis, far greater than anything we've ever seen in our lifetimes. Hundreds of thousands of workers have been infected at work. Thousands have been killed. The single most important action OSHA and the Department of Labor can take to help stop this pandemic, to save lives and reopen the economy, is for OSHA to issue an emergency temporary standard that would require all employers under OSHA's jurisdiction to develop and implement workplace infection control plans, programs essentially to prevent on-the-job transmission. The reason for that is that standards are OSHA's most powerful and effective tool. Most employers are law-abiding. They try to meet requirements issued by government agencies even before the inspector knocks on the door. A standard clearly says, look, this is what you have to do. This is what the law requires. We know that OSHA standards have saved many thousands of lives over the years, and this will do the same. Look, I know that some requirements may not be feasible, and that's what I hear from some employers. We can't do all of these things, but if an employer tries to get N95s, for example, but they're not available, OSHA is not going to cite that employer if they can show they tried to get the N95s and couldn't, and then they tried some alternative approaches. But what an emergency standard says is you have to make the effort. And that's important because there are always pressures not to do the right thing. Look, it costs money. A lot of businesses are hurting right now. Maybe no one at that business has gotten sick yet. So the employer may think they're doing the right thing, but it's just luck at this point. So an emergency standard combined with the possibility of an inspection motivates employers to better protect workers. And it protects the employer too, since it raises the bar for all employers. The ones who are investing in safety to protect their workers shouldn't be at a financial disadvantage competing with those who don't. And all of those, the reasons that President-elect Biden has made a commitment that he has said to the public that after he is inaugurated, he is going to make sure that OSHA issues an emergency temporary standard.
So thank you for that background and context and that forward look as well. So a related question for you a little bit farther out. You led OSHA as it developed a new infectious disease rule. In the short time we don't have that much time. What happened to the infectious disease rule? And do you believe the Biden administration should release it, or are there already enough regulations on the books? And what we really need is more enforcement and education.
When I was running OSHA, we were working on an airborne infectious disease standard. And once we get past this crisis, I hope OSHA will issue that standard. But the bigger picture is more challenging. The OSHA standard setting process is broken. It takes decades in some cases to issue standards, and many of them are really hopelessly out of date. So on December 29th, OSHA turns 50 years old. Jordan Barab, who was Deputy Assistant Secretary, and I have written an essay in the American Journal of Public Health looking back and looking forward, recommending some changes to make OSHA more effective for its second half century. So I recommend pulling that up. But I really want to thank AIHA and its members for their commitment to safe workplaces and healthy workers. You've made a big difference. Because of you and your work, so many workers are able to leave work at the end of their shift safe and healthy, and that's why we all do this work. So thank you, Mark. Thank you, AIHA.
Thank you for the kind words, Dr. Michaels, and thank you for joining us on the show.
Good.
That is all the time we
Good.
have today. I'm Mark Ames. This has been Five on the Front Line. We'll see you next time.